السلام عليكم ورحمة الله وبركاته. معكم التدريسية الدكتورة عدنان شمخي، اختصاص أمراض الدم الصغيرة للبالغين. Today we have a subject, important subject that's iron deficiency anemia in adulthood. المحاضرة موجهة إلى طلبة كلية الطب بالأخص المرحلة الخامسة. Our lecture outline, we're talking about iron deficiency anemia prevalence and causes of iron deficiency anemia, then important treatment options of iron deficiency anemia. Regarding the prevalence of iron deficiency anemia worldwide, anemia is a major public health concern that's mainly affecting young children, pregnant and postpartum women, mainly among low and lower middle income countries. Anemia that caused 50 million of healthy life loss due to disability in 2019. An important dietary content of iron that present in leafy greens, vegans, whole grains, and pumpkin seeds, important fruits and dark chocolate, and red meat. The balanced diet should be contain 5 to 6 milligrams of iron in each 1,000 kilocalorie. The recommended amount of iron in adult male is 5 to 10 milligrams per day, while in adult female is 7 to 20 milligrams per day. The recommended dose or recommended daily absorption of iron is 1 milligram of iron per day. That's absorbed mainly in the duodenum and small intestine. The main content of iron in the body is in hemoglobin. Other proteins that contain and iron is the bone marrow and macrophage and transferrin. The daily excretion of iron from the body is 1 milligram, which is equally the absorption. It's excreted via GIT and nail and skin. The important causes of iron deficiency anemia is blood loss in a menstruation, that's especially in abnormal uterine bleeding or heavy menstrual bleeding. And the important cause is a GIT disorder like esophageal varices, hemorrhoid, or peptic ulcer. In developing countries, we face hooktail-worms and important parasitic infestation. Other causes like in chronic kidney disease with dialysis and other intravascular hemolysis with hemoglobinuria like paroxysmal nocturnal hemoglobinuria. Other important cause due to increased iron requirement and increased demand that physiologically occur in infancy and in young childhood that's required for rapid growth, and also physiologically in pregnant ladies and lactating women. Other important cause is inadequate iron supply, as we mentioned before, and poor dietary intake that's common in infancy and young children, and generally not independent cause on adults, and malabsorption due to duodenum and upper jejunum disease like celiac disease, gastric bypass surgery, and inflammatory bowel disease. Other autoimmune disorders like autoimmune atrophic gastritis and infestation with Helicobacter pylori colonization. Other rare congenital disorder of iron transport like iron refractory iron deficiency anemia, hereditary hypotransferrinemia. The important symptoms of iron deficiency anemia is varies, especially in female presented with hair loss, brittle nails. Other important side effects or other important symptoms like weakness, poor focus, headache, fatigue, and awareness of heartbeat, and restless leg syndrome. Regarding the treatment, we have many lines. The one and the best important line is a dietary iron recommendation. We should educate the patient about the important sources of dietary iron content, as we mentioned before. The other important line is oral iron, and the last one is a parenteral iron. Oral iron therapy that is present in our market is the ferrous sulfate, which is cheap, available, and have a high iron content. The other one is a ferrous fumarate and ferrous glycine sulfate. The advantage, as we mentioned, is cheap and available and easy to administer. While the disadvantage is the GIT side effect like dyspepsia, bloating, constipation, or diarrhea. And the other disadvantage is the poor compliance from the patient, as we need a longer duration of treatment to replenish the requirement and replenish the store. Also, we have a many drug and food side interaction that interfere with the absorption. The last option is the use of parenteral or intravenous iron preparation. We have some indication to start parenteral iron preparation. The important one is the side effect with oral iron preparation, so the patient cannot take an oral preparation. The other important indication is malabsorption, like a patient presented with celiac disease or inflammatory bowel disease or peptic ulcer. Definitely here we need a parenteral iron preparation to restore the iron. So, we have many options of parenteral iron preparation. In the past, we have high molecular weight iron dextran. Now, the most available one is iron sucrose in the form of Venofer that introduced in 1998. The other one is a ferric carboxymaltose pharyngate that introduced in 2008, and iron isomaltoside, which is a monofer, which introduced in 2010, and ferromoxitol, which is introduced in 2012. In conclusion, the conventional preparation like ferrous sulfate, ferrous fumarate, though of having gastritis as a side effect, can be minimized by taking it with food. New oral iron preparations that are available in the market today having a less adverse effect and having a more efficacy. Iron preparations offer an alternative effective solution to treat iron deficiency anemia and improve quality of life in case of iron preparation fail due to a side effect or improper absorption. And thank you.